bony features. In order to describe the bony features, we will divide the femur bone in three parts: upper end, shaft and lower end. Upper end has three following features. This is the head, rounded head, which has a depression at its center called fovea, which provides the attachment to the ligament of head of the femur. This is the neck. This neck is trapezoidal shape. The large blunt lateral projection, which is the greater trochanter, and a small conical projection, the lesser trochanter. Both these trochanters are uniting anteriorly at the intertrochanteric line and posteriorly by an intertrochanteric crest. Now always remember, intertrochanteric line is directed anteriorly and intertrochanteric crest is posteriorly. Now the difference between intertrochanteric line and intertrochanteric crest is that this crest is thicker and you can actually feel it in your hand, while the intertrochanteric line is just like a line connecting the both trochanters. The neck of the femur is trapezoidal. It has an upper end, upper margin, a lower margin, anterior surface and posterior surface. Greater trochanter is large, laterally placed, blunt bony projection that projects superiorly and laterally. It has an apex. This is the apex of the greater trochanter, anterior surface of the greater trochanter, lateral surface of the greater trochanter and medial surface of the greater trochanter. The medial surface of the greater trochanter has a shallow depression which is called trochanteric fossa, and this conical trochanter is the lesser trochanter. Now anteriorly both these trochanters are united by intertrochanteric line, and this intertrochanteric line runs from greater trochanter and winds around the lesser trochanter and continues posteriorly here as a spiral line, and it meets the medial lip of linea aspera. The intertrochanteric crest, which is thicker as compared to the intertrochanteric line, has a tubercle in its middle which is called as quadrate tubercle. Shaft. The shaft is more or less cylindrical in its entire length. In the middle of the shaft, on the posterior side, there is a sharp posterior border which is called as linea aspera, and in the middle, hence it divides the shaft in three borders. This is the posterior border. The one along the head of the femur is the medial border here, and one along the greater trochanter here is the lateral border. Lateral, medial and posterior. These three borders encloses three surfaces of the shaft. The surface between medial and lateral border here is called as anterior surface. The surface between lateral and posterior border here is called as lateral surface, and the surface between medial and posterior border is called as medial surface. Linea aspera, the posterior border, divides into two lips upward and two lips downward. The one lip which is in medial direction is called as medial lip, and the one in lateral direction is called as lateral lip. The medial lip joins the oblique line here, which continues with the intertrochanteric line. This is the greater trochanter, intertrochanteric line, spiral line. The medial lip continues to and join the spiral line, which continues anteriorly as intertrochanteric line. Greater trochanter, intertrochanteric line, spiral line, and here this spiral line merges with the medial lip of linea aspera. The lateral lip of linea aspera continues upward here with a tuberosity or roughened area which is called gluteal tuberosity for the insertion of gluteus maximus muscle. Now with the division of linea aspera, we have four borders in upper end and four borders in lower end. These four borders in upper end are medial lip of linea aspera, medial border, lateral lip of linea aspera, lateral border. Since we have four borders now in upper end, we have four surfaces as well. The surface between medial and lateral borders is anterior surface. The surface between medial border and medial lip of linea aspera is medial surface. The surface between medial and lateral lip of linea aspera is posterior surface. The surface between lateral lip of linea aspera and lateral border is lateral surface. Similarly, there are four borders and four surfaces in the inferior part of the shaft. This is the medial lip of linea aspera, which is now called medial supracondylar line because it is above the medial condyle. Medial supracondylar. Supracondyle means above the condyle. So supracondylar line, medial supracondylar line which is descending downward towards the medial condyle. Lateral supracondylar line which is descending downwards to the lateral condyle. Now these two, medial and lateral supracondylar line, are the bifurcation of linea aspera inferiorly. The posterior surface here between the medial and lateral supracondylar line are now will be called as popliteal surface because it is involved in formation of popliteal fossa behind the knee. The lower end of the femur is expanded to form two large condyles, medial condyle and lateral condyle. These two condyles anteriorly are separated by a surface called patellar surface and posteriorly by a deep gap called intercondylar fossa, which has a notch anteriorly called intercondylar notch. These two condyles have two epicondyles, medial epicondyle and lateral epicondyle. And medial epicondyle posterior superior to the medial epicondyle, there is a tubercle called adductor tubercle.